Hello, the televiewers. We hope that you're having a great weekend. Well, good afternoon, and thank you very much for joining us again this week on The Diary. Today's edition will be dedicated entirely to the coronavirus. Yes, this pandemic which is plaguing the world and which has today become a reality in Cameroon. Now, the Minister of Public Health, Manda Malaki, has announced that officially there are 27 cases of the coronavirus in Cameroon, officially that is, like I was saying, and different measures have been put in place to limit the spread of the virus. So what do you really know about COVID-19 and how is it spread? How do you stay safe? How do you keep others protected? And we'll talk about also all the myths surrounding the coronavirus in this edition of The Diary. Don't go away, you meet my guests just after this transition. Welcome back. If you're just joining us, you're watching The Diary on STV, and today we're talking about the coronavirus, what you need to know. And following the rules and the regulations that have been set in place and the advice that we get from healthcare providers as per the coronavirus, we only have on set today 2 persons. Generally, we have 4 guests on The Diary on each edition, but on this edition in particular, we have 2 guests only, and it's going to continue that way until we curb the spread of the coronavirus in Cameroon, because, well, one of the measures or the advice we get is that you stay at least 1 meter or 3 feet from the next person. Well, it's time for you to meet my guests. Let me begin with Dr. Nguti Anita. She is a hygiene and safety expert, and she works, I insist, with the Mbopi Baptist Hospital here in the city of Douala. Hello, Dr. Anita. It's good to have you on The Diary.
Thank you.
I know that we'll be learning a lot from you since, I mean, this is your domain.
Yeah. Well, it's my domain in Mbopi Baptist Hospital.
Right, and you'll be sharing all your knowledge with us on The Diary. She's not alone. He's the lone gentleman on set today. You've had the pleasure of seeing him more than once on The Diary. Dr. Yafo Eric. He's the Chief Medical Officer at the Government Hospital in Sodiko, that's in Bonaberi, also in the city of Douala. Dr. Eric, it's good to have you back on The Diary.
Thank you.
Right, so let's get into the heart of the subject, because that's what everybody's talking about today in Cameroon. It's what everybody's talking about around the world. It's what's making prime news. First of all, with the basics, what is the coronavirus? What is COVID-19? What is this thing? Let me start with you, Dr. Eric.
Yeah, the COVID-19, so you can abbreviate it, was a name attributed by the WHO. Actually, it's a virus like any other germs, which, if you describe it scientifically, it's an RNA virus. We describe it in terms of genetic material, a single-stranded RNA virus that is very common in causing upper respiratory tract infections in adults and even in children sometimes. So actually, it's a virus, just like you also have bacteria, you could also have other germs. Mm-hmm.
Right. And is there anything you could add to that, Dr. Anita?
Yes, said almost everything. But one other way that the WHO also called the virus was a severe acute respiratory syndrome, coronavirus 2. This is called because the virus behaves the same like the SARS-CoV virus. That was one of the pandemics, because the world has faced 4 pandemics.
Okay.
We have the SARS-CoV pandemic, we have influenza pandemic. So the virus behaves the same like the SARS-CoV virus. That's why they call it the SARS-CoV-2. So from the name, you see that it can cause severe acute respiratory syndrome, which is infection in the lungs, which is something different from what normal upper respiratory tract viruses, like the coronaviruses, influenza. They usually cause maybe catarrh, cough, you just end there. But this virus has a special feature that it goes down to the lungs and it attaches to the cells in the lungs, and it starts destroying the lungs and causes now pneumonia. And eventually the patients, they develop difficulties in breathing, and that's one of the presenting complain of this virus, of those that are infected with this virus.
Right. So just so our televiewers know, today you will get the opportunity, you watching us at home, to call in on the show and to ask whatever questions you'd like to ask, and to get clarifications on anything that you need. So feel free. In just a few minutes we'll be opening the lines, because we really want today's show to be interactive. So you can call, you can participate, you can ask questions, clarify your doubts. Do not stay with we don't want people living with hearsay information or picking things up from neighbor social media which could not be true. Okay, so feel free to call in into the show to ask questions and to get answers to your worries. Now let's talk about the symptoms of the coronavirus, because the symptoms are very common to other symptoms that are not usually that serious. Like when you have a regular cold, like you said, other viruses, you have a regular cold, you have a headache, you have fever. So what are the symptoms that are particular to the coronavirus? How do I know, for example, that I could be carrying the virus, Dr. Eric?
Yes, as you said, it is a disease that looks similar to others, like the common cold that we know. Or in general, most viral infections almost generally have the same common clinical presentations mostly, but the coronavirus has its own particularity. It's true we count most on fever, which is the temperature greater than 38.5. Even the WHO talk of 37.8, more than that. We also have the cough, that's dry cough.
Yeah.
It's a dry cough. And then apart from that, we also notice that we have the sore throat.
Okay.
Yeah, I have sore throat that is present. Now, in case of severity now, we cannot have it progressing now. When it goes down, it now leads to respiratory difficulties, breathing difficulty. That's what is particular here. But in actual saying, it has its differences along the line with that of the common cold. For example, with common cold, you might sometimes not have fever. That's what is particular. But with this, there is fever. That's why I say temperature is a very important characteristic of it. Now, you can also have cough the other way, but this one's own cough is particular because it's a dry cough. Yes, since a dry cough. And then you have many other symptoms you can also group. Sometimes you can have nasal congestion with this, but it is not really common with coronavirus.
Okay.
But we can also have other running nose, trees, etc. But we don't have this particular here. Some cases can have diarrhea or vomiting, but it is not a chief symptoms here. We have just three, as I said: the cough, the fever, and then we have the sore throat, and then the breathing difficulties. Those ones are actually what characterize this particular virus.
Okay. Now, how is the virus spread? How does it lead from one person to another, Dr. Nita?
Okay, so the viruses generally are transmitted from droplets in that the person infected can produce. And so how can you get these droplets? Normally, the droplets, like you were saying at the beginning of the show, they can travel 1 meter, 1 to 2 meters. So if I'm speaking, I can still produce these droplets. If I cough, I can produce. If I sneeze, I can produce these droplets. So if somebody is infected and I am standing like 1 to 2 meters from that person, and the person is talking, coughing or sneezing towards me, I can easily get the infection. Now maybe the person coughs and the cough etiquette was not the right one, or the person coughs into the hands, the droplets will stick to the hand and it can stay in the hand for 10 minutes, even though the duration has not been specified.
Yeah.
And so when it stays in the hand and then I greet you, or I touch another surface, maybe a chair or table, or I cough and it goes on the table, and another person comes and touches it, it sticks on your hand, and if you take it from your hand to your nostrils or to your mouth or to your eyes, you can get infected.
Okay.
So from the way it is transmitted, we can already get how we can prevent ourselves from getting infected from the virus.
Right. Now, it's important that we've clarified how it is spread, because some people are still making the error of thinking that it's through the air, as in you breathe in and you breathe it in, you take it in with you, but it's clear from the explanation of the doctor that that's not how it's transmitted. No, that's wrong. If that's what you thought, you need to correct your thinking right away. Now, let's talk about the methods of prevention. I'd like for us to go over them one after the other, because it's very, very important. Let's talk about properly washing one's hands with soap and running water. Dr. Eric.
Yeah, as I say, the measure of prevention is important. As you talk about washing hands with soap water only. That's your question. Okay, yeah, washing hand is a very good method of prevention, as she was trying to make us understand the means of transmission. Talk about hand, coughing with your hand, etc. So to be able to prevent it, you must understand how it is transmitted, first of all. So we know now that it is transmitted through droplets, as you said. But first of all, you must understand that washing hand is important because most people with the reflex will always cough with their hands. That's what is recommended sometimes publicly for some people. And when they use a hand to cough, you see the hand is already infected. Now, when you infect your hand and you go around touching surfaces or things like doors, handles of doors, those are areas that are frequently touched all the time. And also maybe your pen, maybe your telephone, and other articles, your keys, those are things that are frequently touched. So these are the very powerful site of infection that we can easily carry this virus. So we see hands very important. So washing their hand is a very primordial aspect in this. That's why people are floating around with hand wash, sanitizer, etc. But I believe that there was a study carried out recently during this crisis in China by Professor Wei and Al. They did a study comparing the hand sanitizer and the hand wash to see which one was better. And that's soap water. They actually carried out studies and found out that your sanitizer are just an expensive method of having savons to use your hand to wash with. What they call expensive hand wash. If not, he preferred the savon or the soap wash was just the best and the ideal one because they prove it to have many effects on the virus, to kill the virus and to erase it completely from the surface than the other, and it was the first. But because daily activities, you cannot wash your hand all the time. You cannot have access to washing your hand all the time. So the sanitizers and the other have their place now. Yeah, because they can help to also kill the virus. But if not, to me, the hand wash with soap is better because we know soap, first of all, has its role in contact with heavy germs, whether it's bacteria, whether it's fungi, whether it is the virus himself. It has a very large role to play.
Okay. For those moments where we are obliged to use the hand sanitizers because, well, we don't immediately have access to water and soap, is there a right way to use the hand sanitizer? Is there a proper way to use it? I have a bottle here which we can use to illustrate. Is there a proper way of using the hand sanitizer? Let me come to you, Dr. Anita.
Okay, actually there is a proper way because even to wash your hands.
All right.
Because if you just put the soap and you go and do that, you have not washed your hands. So if, for example, this could be the hand sanitizer and this could be your soap. Okay. So I put usually about 25 mils.
Okay.
It's enough. So it's inside this hand. When I put it, I can close the bottle back and I put it back in my bag.
Yeah.
Because the outside is obviously infected. Inside,
right.
You can put it back. Then I start by washing, by sanitizing this part.
Yeah, the tips
of my
of your fingers.
Yes. And then after, when I do that, I apply here.
Okay.
And inside.
Yeah, between the fingers.
Behind too. And this way. If I end at this point, you'll see that there are some parts that have not been touched.
That's true.
So I do with my thumb, for my thumb, and then this part, this part, and then my hands. I clean. And usually with the hand sanitizer, if you finish, okay, don't forget the wrist.
Yeah.
Yes, don't forget the wrist. So when you do with your hand sanitizer, by the time you're finished, it must already be dry. This has alcohol in it, so
dry
usually it will dry alone. But now if I'm using soap, all that process is how I apply soap to my hands.
Okay.
Now with the soap, the process should take at least 20 seconds.
All right.
So usually you can sing either a happy birthday song when you're washing your hands, or you can sing Jingle Bell.
Okay.
You sing Jingle Bell 2 times. And I actually recorded it is 20 seconds.
Right.
If you do that and you finish, by the time you're done, 20 seconds, your hands will be clean. So you can say that all the parts of your hands are clean. So with the alcohol now, you follow all those steps every time.
Right. So I hope that the point has gone through. It doesn't suffice to just get the hand sanitizers and pour it on your hands and do a quick thingy. You have to be thorough. You have to touch every part of your hand so that you can effectively kill the virus if you have it. If you're carrying it in your hands. Now let's talk about the other methods of prevention, Dr. Eric.
Yes, as you said. You might finish washing your hand meanwhile you already touch your phones, you touch your eye, you touch your eye, you had something that I don't know what I itches or everything. As I was saying, when you use those, the problem with the virus is that he's looking for a mucous membrane to pass through.
Okay.
He gets through the mouth, he comes closer to your eyes, closer to your nostrils. Those are places where when you look at the composition of the kind of tissue that are present there, they are particular. So the virus, when you do those touching of your face, it's like you're simply carrying the virus closer to this site. So it doesn't really end there because it depends on your activities you do per day. If you know you have been in an area where it's contained, because not everybody who is afraid. There are only those who are around areas where we have suspected cases there. And also as a general hygiene measure, it's good to know that you know what you have been doing. Avoid touching everything around, touching your face, going closer to your nostrils, to your eyes, and to your mouth, to your hands. So if you during the day you know you have done this, you best understand what to do. You're washing having a bath is good. I don't know how you're going to do that, but you see it's very complicated to bathe over the day at work, etc.
Yeah.
So other method of prevention, as you said, is very important to understand that one, somebody who is beside another one who is sick.
Yeah.
His preventive measure will be different from somebody who is in the area where there's nothing. For example, areas where cases have not been declared yet. Cases have not been declared maybe because they have not yet diagnosed them, but they could also be around. So we are also afraid all around to continue to do the same measures all around. For example, it will be funny to wear a mask and go around when you don't have no reasons for wearing a mask. Not everybody have to wear a mask. But I've seen some trying to wear mask and drive or sit around until they have difficulties breathing and remove it. Coronavirus now waiting.
And then you see some, they are really sweaty because you cover your mouth and your nose. It becomes difficult. Duala is hot and they are sweating. Let's talk about the mask issue. Okay, now that it's on the table, Dr. Anita, is it everybody who should wear a mask? Who should wear a mask?
Actually, not everybody should wear a mask. Please, I will because if everybody wears a mask, soon the mask will go out of stock, and those that will actually need it will not have access to it. So the person that should wear a mask is somebody that is sick, or somebody taking care of a patient that is sick, or the healthcare professionals.
Okay.
And if you are sick and you are taking care of somebody who is sick, there is also a way to wear the mask. The problem with the mask is that the mask can be a tool to transmit infection. It can instead be now a weapon to propagate the infection, because if the mask is on your face and you happen to be, it gives a false sense of protection. You feel like, okay, because I have my mask on, I shouldn't wash my hands, I shouldn't follow the normal hand hygiene because it can't enter. But now the problem is, most of the times we'll keep touching the mask, pulling it down,
pulling to talk and all of that,
and all those things. And once you are doing that, you've already spoiled the essence. And some people wear the mask for the whole day. After 2 to 3 hours, the mask is more or less useless.
Okay.
Once the mask becomes damp on your face, even if it's before those 2 hours, it's more or less useless. So putting it on the whole day, you are not protected. Right. You can still get the infection, and you can still be propagate the infection to other people. Now, if you are eligible to wear the mask, because most of the times when we go to the hospitals, and if you have maybe a symptom of fever, cough, some strategies that some hospitals are putting in place, you have fever, cough, and they will ask if you have these symptoms. And usually if you are sneezing or coughing, we might just give you the mask to prevent you from spreading, infecting others. Now, how do you put on the mask? Yes. Now, thank God that we have a mask.
Good. We have one to demonstrate here on set, how to properly, for those who are eligible, not for everybody, like the doctors have been kind to explain. Yes, Dr. Anita, carry on.
So the mask have 2 sides. We have the blue and the white.
Right.
So normally, There are a lot of discrepancy, but the blue should be outside. That's the safe way.
Okay.
The blue should be outside when you are infected, because this blue side, it's waterproof.
Okay.
So it prevents infection from sticking on it. But this side it absorbs. So if you're coughing into it, it will absorb it, and it will not pass through the other way. So if it's the other way around, it might instead cause the spread of infection. So normally I'm not supposed to even be holding my mask and playing with it around like this. If the mask is from a safe place, before touching the mask, I have to do my hand hygiene. I apply my hand sanitizer. I'll just be fast. I'll not follow the steps. And my hands are clean. Everything is clean. Then I pick up my mask.
Okay.
Now there are two sides to the mask. We have a side that is thin, and then there is a side that has a metallic part.
Okay.
Yes. This metallic part is the part that is supposed to be on your nostrils.
Oh, right.
Yes. So when you put it on, you make sure that the metallic part closes your nostrils.
Wow. Okay.
Then you pull this part to go under your chin.
Right.
So that's the proper way to wear your mask.
Okay. Can you repeat the piece of information about the metallic part and how you should pull it? Because it's important. People just put, they look funny on the streets.
Yes. So the metallic part should be on your nostrils, and when you put it on your nostrils, you press it in so that it should fit.
Yeah, you close it in.
Yes, let it fit. And my mask is on, and I pull it down.
Okay.
To cover my chin.
Right.
So now my mask is on, my hand should not touch this part.
Right.
Anytime my hand touches this part, I have to do hand hygiene.
Yeah.
So when do I remove my mask? When maybe it's moist, it's damp, or it's 2 to 3 hours that I've put it on, I do my hand hygiene first, and then I remove the mask from here, from the ropes.
Right.
I don't touch this part,
Right.
and I put it directly into the bin. After putting it directly into the bin, I do my hand hygiene, and then I can wear my the next mask.
Wow.
So
Okay. Now, I realize that apart from these, they're called surgical masks, I think. Yeah. There are other types that I see people wearing. Sometimes generally people wear in chantiers. Now I see people carrying those around. Does that help? The other types, do they help in any way? Are they important? Do they play any role at all, Dr. Eric?
No, I don't think that. The people should understand that a mask in a chantier has its own role, mostly for the dust particles, or mostly that those working with Zacam, they are there for the scent, etc. So you cannot compare with this one. As you rightly explained, this is a medicalized type of a mask. This is exactly what we use in the theater. As you rightly described, before we even touch this mask in the theater, we must have washed our hand. Even though for us in the theater, we use 1 minute, 60 seconds to wash our hand before we touch this mask. And we do that, we wear in the same order like she just described. And when we wear it, when we are coming out to hold it again, we're throwing it. It's one time, that's 1 hour, 30 minutes. I don't know how long the surgery might last. The simple reason is also because we are also aware that we can also pass out germs in the environment, also with can contaminate the patient operating also. So this mask is adapted for infectious diseases. It is not the same mask you have on the street, which are adapted for work, for dust purposes, and also like a bike rider, you see most of them have some masks sometime when they run for long distance, or glasses, etc. So this one is mostly for hospital use. So if your mask is not like what she just described here, then the mask is not meant for coronavirus.
Right. And I saw something, unfortunately it's been circulating on social media, where someone claimed that any mask can prevent the coronavirus because I don't know, I cannot remember the words exactly, but whoever wrote or made that post claimed that the virus cannot pass through anything, and so any mask will work. And following that, people have been doing making masks themselves, supposedly. They use all kinds of, now they even use the Ankara wrappers to do masks that people are buying, and they are using because they believe that with those masks they are protected. What should we tell them, Dr. Anita?
Well, I think Dr. Eric already answered that. We have this mask. This is a surgical mask. The only other mask that is recommended is we don't even really have it readily available for the public. The N95 mask, that's the mask that is really for those taking care of the patients, the doctors taking care of the patient. But we don't have that here because that one is sealed. But those are the two masks. And usually these viruses, they have diameters. I don't really have the exact diameter. And so these masks, they have orifices that can prevent the virus from passing through.
Yeah.
But your wrapper or the mask around doesn't have, maybe might have bigger holes that the virus can easily pass through. And so those are just, and as we have established, the masks will not prevent you from getting infected.
Yeah.
If you are not taking care of somebody that is infected, or you are not infected, you are preventing yourself from transmitting it. So the masks have particular use. It's not for everybody.
Yeah.
I think the only way that we can prevent this virus is what Dr. Eric has explained, the hand hygiene, washing your hands, don't touch your face with your hands, don't touch your mouth, your nose. Those are the ways that we can prevent this virus.
Okay.
Now, also, not to forget, sorry, the reason why overcrowding was also avoided was because, as we said in the beginning, you know, we'll talk of droplets. When somebody sneezes, when you have, because for the moment, we don't know who is infected yet.
And who isn't,
Who is not yet infected at all. Now we are in a crisis, we are still identifying cases. We can want to believe that we might equally have been having cases who have been coming and we consider them for normal upper respiratory tract infections. And we are treating them just like that. And some might even die even without even knowing that there was corona even. So with that, the overcrowding was a very important measure taken by the minister, because with overcrowding, it is a very important risk factor for most of this transmission of respiratory tract disease infections. When you cough, or when the person who is infected coughs or sneezes, and those droplets comes out, they have the ability sometimes to maybe remain in the atmosphere, or maybe hang on, stick on surfaces. So you with your mask is just to avoid not to inhale that when you pass by. Or when you're in that crowd. So the only best thing to do is to avoid the crowding, because overcrowding is a risk factor. That's the first thing. And now, if you're also in a hospital where there are patients who are also present, you don't know whether the person just coughed before you enter, or how often the patient, because cough is one of the clinical manifestations. Each time they cough, it comes out. It's true that why during this time of this pandemic, some scientists discover also in China that when you cough, when somebody sneezes, actually the particles that comes out can even go up to 10 meters. But actually those heavy droplets that comes out, they can only last only for maximum of 2 meters. And they believe that that is where the coronavirus actually really resides. So they're interested in that. So averagely, some people believe that besides infected people, you need to be at least from 1 meter and above to be sure they are safe from his cough or his sneeze. So you should not go within the beyond that reach. Now, equally, we should also understand that as we are describing the issues of the mask, most of the time, people forget to know who has used the mask, because there's a problem with masks now. A used the mask and left it, B come and pick and use again. And then equally, those who work in the hospital must make sure that they can be able to systematically control the mask to those who are infected. So that they don't reuse it again by the neighboring person, because people believe that when you wear the mask, you are safe. No. If somebody who have the mask put on the mask who is sick, is because if he sneezes or he coughs, it remains within his limit. So if somebody picks that mask and there's a way, those particles are still remaining on the mask. So it's very dangerous equal at that time. So only those who have to wear those masks are those who are infected. They don't cough. If they don't have a mask, let's also consider that, because very soon masks will also get finished. If you don't have a mask and you find yourself having cough or sneezing, actually it is good to avoid coughing or sneezing in such a manner. Or if not, you can respect a distance to keep away to avoid or spreading the infection in another way.
Just to quickly remind our televiewers that they can participate in today's show. We are going to put the numbers up now, and we're going to leave them. The numbers are going to stay there. You can call live on the show. We are live, of course. You can call and participate if you have any questions on the coronavirus, anything you need clarification on. Please feel free to call. The doctors are here and they are ready and willing to answer your questions. Now, let's continue talking about the coronavirus. I've been reading the WHO recommends that if you have those symptoms, what you should do is stay home. And the government has said in Cameroon that once you see that you have those symptoms, stay home and then call the toll-free number 1510. So what happens? I mean, you're the doctors, I'm sure you've been preparing in your different hospitals. What happens if you're called up and they say there's a case that your hospital has to attend to? What happens from there, Dr. Anita, at your level?
Well, in Bopi Baptist Hospital, we don't have the capacity to hospitalize the patients yet.
Okay.
But if we have a patient that we suspect that has coronavirus, we have a room that we have prepared to isolate the patient.
Okay.
In the room, we evaluate the patient, we do some tests, because even though we don't have the test kit for the virus available in our hospital.
Okay.
Yes, but there are other tests that we can do. We can do the complete blood count for the patient, and there are some features on the complete blood count that can tell us that probably this is actually the virus. But while we are doing that, we are supposed to call, we are supposed to report to the
Authorities?
district office. Yes.
Okay.
So presently, where the patients can be hospitalized in Douala is in La Cantini. That's the reference hospital, I would say, for now.
Okay.
For that. So the patients now, we call in, and then we have to now look for a proper transportation to transport the patients. And while attending to the patients normally are putting on a mask, and then
Okay.
we also have our own personal protective equipment that we put on to attend to the patients.
Okay.
And usually we have, like in Bopi, we take their temperatures at the entrance. We have
Great.
someone to take the temperature at the entrance, and then where to wash your hands and to sanitize your hands. So they'll take your temperature. If your temperature is greater than 37.8, we ask you if you have any other symptoms. If you have cough, you're sneezing, we give you a mask first. Then we ask other questions if you have been exposed or any other thing. And then if we see that those symptoms are looking like coronavirus, that's why we take you to the isolation room.
Okay.
And then we evaluate you there. And then if we are still the suspicion is very high, we'll call in, and then we'll make sure that the patient is transported there. But as you said rightly, the best way is that we should know the symptoms. If you have cough, you're sneezing, you have fever, and you are now having difficulties in breathing, it's better to quarantine yourself. Quarantine yourself is stay home, stay away from people, and then you call the health the health professionals. Now they will give you direction on what to do. Whether they will come and take you from home if your symptoms are very severe, or if you have mild symptoms, they might just tell you to monitor the symptoms, and then if it progresses, then, because most of the symptoms are mild, especially for people in a particular age group.
Yeah.
But this is important too. It doesn't mean that those in that age group don't have the infection. They can get infected. And it doesn't mean that all are mild. Some are mild, but some can progress to have severe symptoms.
Okay.
Yeah, but from the statistics, severe symptoms have been found mostly in people that are older than 60 years and people that have comorbidities.
Okay. Sorry to cut in there, doctor. We have someone on the line. Hello, good afternoon. Welcome on board the diary. What's your name, sir? And where are you calling us from?
Yeah, I have a question which I want to ask.
Okay.
Coronavirus.
All right, go ahead.
Yeah, the problem now is they say that when you cough or you sneeze, it means that you have the symptoms. It means that somebody cannot have a normal cough or just sneeze. Does it mean that that person must have that coronavirus? Because I'm really confused right now.
Okay. It's a good question. So we're going to give you an answer, sir. Dr. Eric, I'd like for you to answer that question.
Yes, as you rightly questioned, cough or sneezing. As you rightly said in the beginning, there are two kinds of cough you can have somebody. You can have a productive cough. That means you cough, and you can have a sputum cancer and a dry cough.
Okay.
So we say the cough we are characterizing here is a dry cough. Okay. That's the first thing. Secondly, you can even have normal sneezing. Sneezing normal is a normal reflex that everybody repair because it's a mechanism of defense still. Yeah, whenever those particles enter your nostrils or whatever your nostrils are irritated, you have the right to cough or to sneeze. Sorry. Now, we said the key symptoms are temperature. That's why you see mostly we're looking at the fever.
Yeah.
So fever is very important, and then the dry cough that comes in again, and then usually the cough you feel some sore throat,
okay,
maybe pain, etc. Those are other characteristics that makes us to think that you are a case that we can suspect. It doesn't mean that you have coronavirus. You can still have the fever, you can still have the sore throat, you can still have the cough or the dry cough, but it is not coronavirus. That's why you must rush to the hospital so that we can better place to select your case and know where we can put you in. Still, when we have those suspected cases, any health personnel around can orient you. If not, you go and crowd like Anthony there with many cases because people no longer have the normal cough again. You can also cough. Cough also normally is a normal reflex equally. Yes, you can cough because of the environment. You can cough because of your normal common cold, where there are also symptoms common to that of coronavirus. So when you come to the hospital for consultation, at least a medical doctor will be able to distinguish if your cough is normal or not. But in everything, it is good in hygiene that when you cough, don't cough anyhow on the public. When you sneeze, don't sneeze anyhow in the public. If you have cough that has been going on during the last days, accompanied with fever, that means your temperature, you feel cold, because when your temperature will rise, you might not know. That's one thing people forget to know. When the temperature of your body increases, you might not feel hot, but you would rather be feeling cold, because the increase in temperature makes you to, you might have shivering, for example, or you would rather feel cold in the extremities, etc. That prompts you to do, to measure your temperature. So it is important to understand that cough alone is not a criteria for the diagnosis.
All right, so we should remember that apart from coughing and sneezing, picking from what the doctor said, if you have fever or your temperature is increasing, and if you have sore throat, and what else? I think those are the other things that accompany it. If they accompany it, then you should first don't cough on people. I think the advice is you cough or sneeze in your elbow, or you use a tissue, and once you use the tissue, you dispose of it properly immediately. You don't use it a second time. You don't keep it in your bag. Okay, we have another caller on the line. Hello, good afternoon. Welcome on board the diary. What's your name and what's your question?
Yeah, good afternoon. Good afternoon to the doctors on the show. Good afternoon also to the host. My name is Victor Samko. I'm calling from Manda in Bonaberi, Douala. My worry is this. You know, we are in a society or community that is very cash intensive. The way we handle money. People go to the market or go to the shops and they exchange money with these same hands we're talking about washing and sanitizing and stuff. My wonder is, to what extent can we really be careful in a community like this, where money exchange through the hands is so intensive in any commercial exchange that we want to get involved in? Honestly, I'm just so worried about this whole money exchange. You go by taxi, you pay money. You go by Benzikin, you pay money. You ask for change, and so on. It's just so intense, this hand exchange of stuff. How careful can we really be in this regard?
Very much for the question. We're going to try to give you an answer, and I'm going to throw this one at you, Dr. Anita.
Okay. Actually, well, the truth is that I also thought about that, like money, because it's the surface that the virus can stick on.
Yeah.
That's why we have to be very intentional about our hygiene practices now.
Okay.
So if you are careful not to touch your face, your eyes, or your mouth with your hands, then that's one thing already. You're winning already there. But now, what if I collect money from somebody?
Yeah.
What I do personally is that if I take money, I put it in my purse and I put it in my bag. And I remove my hand sanitizer and I perform my hand hygiene. If I touch any surface with my hand, I perform my hand hygiene, even though it is advisable not to touch doorknobs with your hand, or elevator buttons, or surfaces with your hands. But now in that case, money you have to take away. And it's not as if you open your purse and drop it inside. Yes, we cannot do that. So it's just to maybe have this available. But now if you don't have it available, maybe you are going to the house, you can still put it in your bag and still go to the house and make sure you wash your hands first and before you do anything or you touch. So the main thing is only for us to always remember to do our hand hygiene practices, which involves washing our hands. And if we don't have access to the water and soap to wash our hands, we can use sanitizer to sanitize our hands.
Right. Now that we're talking about washing, touching things that we touch all the time.
Yes, hello?
Okay, we have another caller. Hello, good afternoon, madam. Welcome aboard the diary. What's your name and what's your question or contribution?
Good afternoon. My name is Bechem, and my question is, for patients who have already been infected with the coronavirus, do they have an immunity to a second infection? Or is it possible for them to be infected again if they are exposed? Thank you.
Very much, madam, for that question. Thank you for calling and for participating. I'm going to leave it to the doctors to answer that because anyways, I have no ideas in any case. So, who would like to take that one? Dr. Eric?
Anyway, I will begin.
Okay.
To end the question.
Why not?
Yes. We should also understand that while we sing about coronavirus all through, it doesn't mean that our body is doing nothing. Yeah. The body actually has an immunity and so many mechanisms of defense. First of all, we should understand that when it comes to defense, we have our the non-specific defense system that the body has, which is not specific to any particular gene, but everything. For example, just the nostrils.
Yeah.
We have some hair cilia, which can describe hair follicle with their cilia in the nostrils. Also, we have some special cells in the respiratory tract that are capable of producing mucus, what you call kata.
Yeah.
In other words. So every germ that comes in through the nostrils, or particle, or those bacteria, etc., the system automatically produces this mucus to trap it, and these cilia help to bait it out.
Okay.
So kata coming out actually is a good thing. Equally, it can come in and then irritates, and that provokes you to sneeze. So when you sneeze, you're actually sneezing out the germs.
Okay.
On the other hand, cough also can also be one of them also. You either send it out through cough or you sneeze it out. Now, when this particular defense system is being broken and the bacteria or the virus happen to cross through these membranes and get into the circulatory system now, the body also responds also by antibody production equally.
Yeah.
To produce antibodies to fight against this virus specifically. So the body also fights and destroys it, even though we claim to also have many other treatments that are out to treat the disease, like our hydroxychloroquine, etc., which are out to treat it, and many have been tested, proven positive. But we should understand that, firstly, the body has a defense mechanism. Most viral infections, once you are exposed the first time with it, the body actually will really have to suffer the first time.
Okay.
But the second time, for us to really define they are really immune with it, therefore means that the body must have learned, and the body will always do something to fight the second time. But that has not yet been proven to test to tell us really whether we cannot be infected the second time. Because I think the first outbreak of this virus since 2012, what you just described last time, that is severe acute respiratory syndrome. I also had what we call the Middle East respiratory syndrome. These two breakout, that was in Saudi, south of Korea, South China, Saudi Arabia, and also in the south of China.
Okay.
Yeah, south of China had the outbreak of severe acute respiratory syndrome, and then in Saudi Arabia had the Middle East respiratory syndrome. This virus came in and had the same clinical presentation. So after all this, why you see we have been we never had again a case of it, which means that certainly the reinfection might have been treated by the body automatically, and certainly we have cases that might also go through without even administering any treatment. Some were treated automatically by the body's immune system. So first of all, there is an immunity first. That's the first you understand. We have the non-specific immunity. We also have the specific immunity that the body offers. And thirdly, now we can now see the body also responding to secondary infection also. He also will normally have to react because the body must have learned and also be used to this infection the first time that you have it. The second time, the body must already be able to learn how to produce antibody against it specifically. So by history, I can respond to that question by history that if this virus break out in 2012, and has not appeared again throughout all this time, we can also believe that the body actually immunity has, except other scientists have proven that, but I cannot. Maybe Dr. may continue.
Yeah, I actually read a document that they were trying, because the Food and Drug Association also, that they are trying to produce the treatment. So they are thinking also of using the antibodies from people who have been cured of this, who have been treated of this infection, who have recovered. So it's a possibility that when you get infected, you develop the antibodies that Dr. Eric was describing, and then you become somehow immune, but that has not been established.
Okay. We have to understand that COVID-19 it's new. They say call it the novel virus, so the novel coronavirus. Okay, we have another caller on the line. Hello, good afternoon. Welcome aboard. What's your name and what's your contribution?
I'm John from Lime, and I want to ask it more of a technical question. We know that the virus is being confirmed with PCR tests, and that's when we come to the case. And then at the end of it, you have to do the same PCR testing to declare that the patient has been healed. How come there is no treatment, and in between the virus gets disappeared?
Much, sir, for your question. I'm going to give Dr. Anita the opportunity to answer the question.
Well, I think the answer is in what Dr. Eric explained.
Okay.
Your body also responds to it. So most people, like in Italy, like among the young people whose immune systems are strong, they usually that's why there's part of the management that is home care. You stay at home and we observe. So we are trusting your immune system to fight it.
Okay.
So the people usually that decompensate is those that maybe do not have a strong immune system. Their immune system is not strong enough to fight the infection. But there is no cure for the virus yet. But there are people that get through the virus without any cure, without any treatment. Now the PCR test, it tests the antigen. Usually every virus, they have like proteins on them that the body can detect and say that this is the virus. HIV has its own. And then afterwards now, there are other antibodies. You have antibodies that are produced in acute infection, antibodies that are produced when you have recovered or to show that you were infected before. I'm sure that if you do the test to check the antibodies that show that you have been infected before, that will be positive. It doesn't mean that you actually have the infection.
Okay.
But now the test now that is done after is to find if the virus is still there and is actively replicating. So that's why the test is negative after you have, because your immune system has completely cleared of the virus.
Okay.
Yes, but there will still be memory in your body that shows that this virus has been here. But it doesn't mean the virus is there.
It's still there.
Yes.
Right. Like I was saying before the question came in, it's a new, it's the novel coronavirus, and there are still studies that are being carried out, and every day we're learning a little more about the virus, and as we learn more, then there'll be more clarification about some things concerning the virus. We're going to continue while we're waiting for others to call and ask their questions. Now, there's something I wanted to talk about. There are so many myths around the coronavirus, especially in Cameroon. Now, I'd like for us to break those and see which is true and which isn't, and what people should follow and what they should absolutely ignore. Now, the first thing I wanted us to talk about is many Cameroonians are under the impression that because we are in Africa, we're in sub-Saharan Africa where it's so hot, the virus cannot get to us. It is true that the minister said we already have 27 cases. Some have decided to ignore that information. But is it true that because we are black and because we're in Africa, we cannot get the coronavirus? Dr. Eric.
Anyway, people are just based on some other minor fact that has been realized about the virus, but we cannot be certain about that 100%. In the beginning, they said the blacks were stronger than the white. We cannot have it. We started from one case. Today we're in 27.
Exactly.
So can you say explain that blacks cannot have it? Yes, we can. But we should also understand that, like the question somebody asked about money, handling money, we should understand that there are some surfaces where the virus cannot last for long.
Okay.
That is why the risk of transmission from surfaces is very low, but it is possible. Those are questions that were asked WHO and they were actually fully responded. The risk of transmission from surfaces, this is true. Every surface that is touched regularly should be clean.
Yeah.
You can use any method of cleaning. Like you wash it with soap, that's nice for you. Like you apply it on the side, you have more to spend. But you should understand that it will last for hours to days on a surface. It can last on your money and remain there waiting for you.
Yeah.
So you should have that understanding first. And then secondly, you should also understand that some conditions are not really favorable. They make the virus unstable. Like temperature is one of them, like moisture and etc. The virus is unstable. We cannot really tell you that the virus will be inactivated by temperature or will be killed by etc. And if you call it, if you look at it in some of the good hand sanitizer, that's why the WHO recommended us to add hydrogen peroxide, that's the low oxygenate. That one does not really have an antiseptic effect, but this rule is just to inactivate the virus.
Okay.
Inactivate it. So we should also understand that you cannot just say temperature or body. Particular people have risks. For example, most of the people who are dying today, the average age in a study carried out in China was 47 years. Okay. Average, that means those who actually suffer and had complications and went to severity, that was severe respiratory disease infections, were 47 years of age. Which means that they came to understand that some people were really at risk of scoring a more severe form of this disease. That is the old people, those who had cardiovascular problems, diabetic patients, and those who have immunodepressed patients in general, whose immunity is not strong enough to fight the virus in the first onset. And when it's not strong enough to fight the virus or to offer that protective defense system I just described earlier, you will be forced to see the virus going down to give other severe complications now, like other respiratory problems. Some can even go on coma. Some have serious respiratory syndrome, which I just described earlier. So those are the people, once you get into that phase, the ability to save you is difficult. For example, if I will not lie you, if you have 50 of those cases in Cameroon now who have attained that severe form, who will be unable to handle it because of what? Maybe the equipment and material, etc. And nobody is ready for that kind of case. So we see people die in large number. Look at the age group. Let's not call the race. Let's not say black or white, because we cannot talk about race again. That question has already been annulled by the fact that it's increasing in us. Let's look at those who are exposing themselves. So if you have a respiratory tract infection or a disease, I don't know whatever complication you may have, like diabetes, know that your own case, if you have the virus, the evolution in your body will not be like somebody who is normal. You all will be faster and you will easily progress to difficulties in breathing, and you will reach a level where you need special devices to assist your breathing. And I can tell you that you might not be able to have that. For example, I learned Hospital General have about 10 of those devices, 10 to support 10 patients with, if you reach that level. So I cannot go, let me not even count other hospitals. Let me just talk about that. So you see that if you are a person at risk, what I've just described, you must take special precautions. That's why I say the minister makes people to stay home. It's for no reason. If like people hide and say go and be entering the bars, you are not hiding for you are putting yourself at risk. Secondly, if you are a risk factor, as I've just described, in terms of your age, in terms of your disease or complications you are having, or maybe you have respiratory disease, etc., know that if you are a victim, your own progression will be very rapid and very catastrophic.
Right. I hope that is really clear. Is there anything else you'd like to add, Dr. Anita, on that before we move to the next one? Okay. Another thing people have been saying a lot in Cameroon, they say you should drink water every 15 minutes. And if you drink water every 15 minutes, it's going to wash off the virus, even if you pick it up. We'll come to that in a minute. There's another caller. Hello, good afternoon. Welcome on board the diary. What's your name and what's your question?
Good afternoon. This is Dr. Manda calling from Manda.
Okay. You're welcome. What's your question, sir?
So we have been hearing studies about chloroquine. That chloroquine seems to be working on the virus. So I want to know from the doctor if this chloroquine has some side effects. Because a lot of people have been complaining about the side effects of chloroquine. We know we used to use this drug before, but it's disappeared in the market. So now that the Chinese virus is already here, can chloroquine do the job? Because even the President of the United States talked about chloroquine. So I would like to know.
Okay. Thank you very much, Mr. Dobgima, for calling. I'm going to allow you to answer that question, Dr. Anita.
A lot about this chloroquine after I started hearing that President Trump said it could be used. But first, they said it could be used to treat, not prevent. So don't take chloroquine when you don't have coronavirus. It will not do anything. It will only manifest as side effects. And actually, chloroquine has a lot of side effects.
Right.
The first one, they are basic side effects. It can cause nausea, diarrhea, vomiting, and it can cause itching of the skin. We know that about quinine mostly. But it can cause other complications like even retinopathy. It can affect your eyes, blurred vision, and it can lead even to blindness, irreversible.
That's serious.
Irreversible blindness. It can affect even the respiratory system, the heart. It can affect all those things. So the first thing is that we should not just go about taking chloroquine when we don't have the virus. Now, in some countries, they have protocols, but those protocols have not been approved by the WHO.
Exactly.
Those protocols, they are protocols that maybe the country have decided that, okay, we will want to take the risk. Even though chloroquine maybe has these side effects, but we will still give it, but it's a prescription drug. There is a particular dosage that those countries give it at. And I think that there is a protocol that has been given here in Cameroon, but that is to treat the virus. So we have to confirm that you have it, and then we give it at a particular dose. And we don't give the chloroquine alone. It's given in some countries, it's given with some drugs that's used to treat HIV, lopinavir and ritonavir. They use it with that. In some countries, they use it even with interferon. We don't have that yet. In some places, they talk of using it with azithromycin. So chloroquine, actually, they are doing clinical trials on it. Yes, and it has been showing some positive results, but they have not approved. Before a drug can be approved to be used, they have to go through a lot of trials and all those things. Yes.
If I could just add something, Doctor, I was following Trump's interview live. I was watching it live, and he did not say use chloroquine. Okay, he said there are trials being done, and if it works out, it could be a great thing. But I remember the director of the FDA, who was standing right next to him, explained that it's going to take months and months. He was not as positive. He is the expert. Okay, Trump is the president. He's not the medical doctor. All right, and the expert was explaining that it would take several months, 3 to 4 months, before they can say if chloroquine is a good idea. So do not just jump into conclusions because he said chloroquine. We have to be very careful. I've heard unfortunate stories of people passing out in Cameroon because they overdose on chloroquine as a preventive medication. Like the doctors have explained, that does not work. Do not put your life at risk, okay? I'll leave it up to the experts to tell you what to do. We are still expecting to get several calls for your clarifications. We have another one already. Hello, good afternoon. Welcome on board the diary. What's your name and what's your contribution?
Wow, good afternoon. I'm calling from Boya. My name is Fombele Kitu. Yeah, I want to just verify something about the coronavirus issue. The problem is that when you have a lady, so what's the difference between you and the lady, like making peace with the lady? Is it good to have peace with him? Or, I don't know what to say, because during of what is happening right now, we have girlfriends. We young people, we have girlfriends. Usually we have to make kisses with the girl. So what is the difference to do right now? Please, I don't want to know about that.
Very much, sir, for the question. I think the gentleman is talking about intimacy between couples. Should anything change with the coronavirus? Who would like to jump on that one? Dr. Eric?
Anyway, I don't know where to start, but I just want to call the attention of the population that they should not really be much more afraid than ever. But it is normal to first of all start by identifying who is at risk. For example, like we already said in the beginning, if you have a case of somebody who just entered the country, let's say left from France, anywhere from the borders, who has crossed the border these last days and came into Cameroon, start from that place to start evaluating first of all. We said the time to be infected, to be contaminated with the virus, and for it to start manifesting its clinical, the sign and the symptoms, it lasts between 2 to 14 days.
Okay. Or
let's say 2 weeks. So if you have a stranger who has entered, who is around you, and it has not gone, after 2 weeks you observe the person, if the person have not present any of the signs and symptoms we listed earlier, know that you are safe for another person. That's the first thing. Secondly, if you have a case around you are suspecting, first of all, you should be afraid. But you cannot be with somebody who is normal, he is not having no cough, he has no fever, it has no particular sign and symptoms, you are afraid. Be afraid of those who have left from outside of the country and they're coming in. Though they have no sign and symptoms, but they are in a phase where they are still infectious. They can contaminate other people during that time. That's how we talk of putting them in quarantine, for example, is because we want to isolate them to avoid them spreading, because they can spread without even manifesting any symptoms yet at the beginning. So I think that's a very important criteria you should look at. The truth is that you're sneezing, somebody who is infected, if you are manipulating with somebody who is infected, that's the truth, you know you're going to be contaminated. Either touching things around the person that the person has touched, or maybe the person has sneezed or had cough, as we described in the beginning. If the person cough and sneeze, it's true, the cough and the sneeze pass to the nostrils, they pass to the mouth. So you certainly, particles will be found there, but until the person has been proven positive, don't be afraid about making love with persons that have no risk factors, they are not exposed, etc.
Coronavirus should not affect your intimacy, your love life. It's what the doctor is saying. As long as the person is not presenting any symptoms, the person has not come in contact with someone who is infected, the person is not coming from out of the country, a place where there are many cases. So, well, I think the answer was very clear. Well, we're going to continue. I was going to ask a question about the belief that if you drink plenty of water every 15 minutes, it will prevent you from getting the coronavirus. Is that true, Doctor? Dr. Anita, that is. Okay, before we get to that, hello, good afternoon, welcome on board the diary. Your name?
From Manda.
Okay.
Good afternoon, I'm J. Solomon calling from Babinda.
All right, good afternoon. A question.
I was expecting journalists to teach us practically by wearing their face masks on the panel, and the doctors also to teach us how to prevent ourselves as the government has said. And also my worry is our markets are still going on and everywhere is busy as normal, of which I expected by now we should be having something like a quarantine. So are we all safe in this situation in which we find ourselves? That's my question. Thank you.
Very much, sir. Thank you for calling. Thank you for participating. Thank you for your question. I'm going to answer the first part of the question because it's not a technical one, and then I'll leave the second part to you. I wonder if you started watching us from the beginning of the show, but I doubt seriously, because when we started the show, we explained that except you already have the virus, or you're taking care of people who have the virus, then you do not need to wear a face mask. It was really clearly explained here on set that except you are sick yourself and you don't want to infect others, and you're a medical personnel, you're working in the hospital where you come in contact with many people and you come in contact with patients, then you do not need to wear a mask. That was explained properly. That's why we are not wearing masks on set, because we do not need it. But we have respected the rules put in place by government. That is why we are at least 1 meter away from each other. That's the measure we are respecting. Generally on the diary we have 4 guests. That means would have been 5 on set, but because our space is limited, today we have cut down the number of guests to just 2. So we are just 3 of us, and everyone is safely away from the other person. So we are respecting the rules and making sure we do not contribute to spreading the virus. Now to the other question about the markets and people interacting. Would anyone like to say anything about that?
Yeah, we should, as I already said in the beginning, every point of gathering, as you said, overcrowding is a risk factor of this infection. We should understand that. Time will come when we will expect the minister to stop every movement. Yeah, because I think there are countries where everything is stopped. Everybody is indoors. That's the first measure that helps us. For example. Those who are infected remain in their houses until they carry to the hospital treated. The doctor wait for you in the hospital, and you stay home and wait until you are a victim before you move out. If not, I think the market, as I said, is right. They should have reached a level where they have to close the market. But because of our context here, I think out there, people stay in their house and make calls. They come and save them food in their houses. But here we are unable to have such facilities. So we are only be forced to go out and buy and come back. For now, because we don't know what the future might look like. We don't know, because very soon the thing will become serious. Or it might become, as we've seen, the number keep climbing every day. More measures still have to be put in place. I already said in the beginning that the probability of being infected from surfaces and food items, that's what WHO responded, is very low, but it is possible. We say yes, it is low. It is not as common or as possible, as frequent like the sneezing and the coughing and being in contact with the case, what you need to be observing is anybody who cough around you, just start wearing your mask. It's important until the person is proven negative. Any suspected case with a dry cough or the symptom I just listed out, just try to get a mask and wear. I will not forget, we just discovered recently that the chloroquine just got finished all around. The pharmacies. The masks are also getting finished so soon. Yeah. Don't spoil your mask because if nothing is coming in, certainly we are not producing masks here. So the few we are just using will get finished very soon.
Because even in the countries where they produce masks, they have run short. In America, in France, in the UK, the government is trying to get people. Okay, I think we have another caller. We'll come back to this because it's important. Hello, sir. Good afternoon. You're welcome aboard the diary. What's your name and what's your question?
Good afternoon. I would like to go anonymous, and I must appreciate the effort that your team is doing. I think it is first of its kind, especially in the Queen's language. And I heard you talk about myths of coronavirus, and I think there's one. I don't know if we could consider it a myth or a level of ignorance and stupidity. I'm very convinced there are so many Cameroonians who do not believe in coronavirus. Worst of all, those who fall under the umbrella of believers, Christians, call them whatever you want to call them, who still think that it will take the mercy of God to solve the coronavirus problem, rather than taking the measures put in place by the World Health Organization, by the government of Cameroon, as well as other paramedics. I think you should, I don't know, with the help of the doctors, you've done already much of that sensitization, but I think you should hit hard on those who believe, who still think that the issue of coronavirus should be taken lightly, should be looked from a spiritual angle and not a physical angle. There are people who still go for gatherings under the canopy of church, still gather more than 50, hoping to pray that God fix the problem. He leaves his throne and come down to fix the problem. So I think, well, I don't consider this a myth. I consider it something we should hit hard on, because it is like a hiccup can easily generate into cardiac arrest if care is not taken. I'm talking about those who do not still believe that coronavirus is real, and they think that it would take spiritual measures to curb the problem. Thank you so much.
Well, thank you for your contribution. I'm glad that this came up, because I was hoping that at some point we'll get to talk about this on the show. It's important to talk about this. There are actually people who are convinced that if you wash your hands all the time and you're sensitizing others about the coronavirus, you don't have faith. Is the coronavirus real? I know we've talked about this, but for the benefit of those who still believe that we should pray to God to not get the coronavirus, what do we tell them, Dr. Anita?
Okay, I'll first of all start by this disclosure. I'm a Christian.
Good.
I'm a believer. I'm a born again. So, and I believe that coronavirus exists. I'm a doctor, so I believe in most diseases and all that. The truth is just that I will not disregard the factor of God, but the truth is just that we still have to practice. If you believe that, the truth is, even if you read in the Bible, there are some places where they will ask you to take these for your stomach. Let me give Paul telling Timothy, take a little wine for your stomach and all that. So we cannot disregard that fact.
Okay.
Hello, how are you?
Okay, hello. I think we should answer this question. We'll call back to you, sir. Just call back in a minute, okay? Just give us 1 minute. It's important that we answer this question, and we'll take your call. We promise you just a little patience so that everybody gets answers to their question. We'll take your call in just 1 minute. We'll give the doctor some time to respond to that question.
So I would say that this is really like what he described is dangerous.
Very.
For people not to believe that this virus, because if you don't believe in it, you will not take those measures, and so you will be like a weapon of mass destruction, because you will be like a weapon that the virus will use to spread itself. So we have to first of all believe. There are many things people are saying that it's a political propaganda, it's a what. there are all those things. The truth is that no matter what you believe, when the virus will come, it will become real. I will give an example of what is happening with even the HIV virus that we have. We have many people, patients that will come to the hospital, that they'll put them on drugs for medications, and they will leave and go to churches and they'll pray and declare them healed. And they will stop taking their medications and only come maybe 3 months later that they have already transitioned from the phase of HIV to AIDS, and they will come and die there, and those pastors will never pass. They will never come to see the patients. So some of these things we have to be wise.
Yeah.
And sometimes God, in the days of ignorance, God overlooks. But now we are not ignorant.
Yeah.
We know, they have told us, we have cases, the proofs are there, and it is killing. In Italy, we're having 600 people dying in one day.
That's where the Pope lives.
Yes.
That's where
we
the Pope
have
lives.
600 people dying in a day, and all those things. It is real. And if we don't take it serious, when it comes here, like Dr. Eric was saying, the capacity of our health system cannot contain all of us. It cannot take all of us. And if you start coming to, we might not even have where to put patients to lie.
Yeah.
Like in the communique the minister gave, he talked about, the prime minister that talked about the hotels giving us space to cry. That's already should tell us that there's an issue. So we should just keep aside all of this. I've not said that people shouldn't pray. I've not said that people shouldn't believe in God. They should. But you should still be careful, because God will not come and, because you are careless in the name of faith, and then just come. I think that this is really a serious issue that people should really take it serious, and they should forget all these things and forget all these lies. I'm very sure some pastors that will come and stand and tell you, if you look in their bags, they have hand sanitizers.
Yeah.
So we should really be wise.
It's important. We all have a brain. God has given you a brain, has given me a brain, and we can use those brains. It's already His way of blessing us. I read recently in Kenya of a pastor who fed, I don't know, call it feed, but he gave Dettol to his Christians in his church to drink in the name of it to stop them from getting the coronavirus. And guess what happened? 59 of them died. He did not drink it. He's not dead, but 59 of his patients are dead because they believed in what the pastor told them, that if you drink Dettol, you're going to be safe from the coronavirus. We are humans. God has already blessed us, okay, by making us to be alive, to be able to think, to be able to reason. Use what God has given you, okay. Let's take this thing seriously. Dr. Eric, you want to add something?
I think that the church should. People always like to pray. It is true. God has a place in everything. The Bible will tell us that God said many times in Deuteronomy that He will strike the world with many kind of diseases. That's why people explain why HIV is still there. But we should understand that the Bible also says in Colossians that Jesus Christ was the embodiment of all knowledge. So the science we apply in the hospitals today, it is not coming from elsewhere.
Exactly.
It is the knowledge that God has given to us that is applicable.
Yeah.
So the hospital have its place. The church have its place. It's true that God covered everything, but there are some duties we have to take into consideration. Tomorrow, many will go to church. Many churches have bought hand sanitizer to apply the entrance of the church. That is not going to save anything much, because inside the church, that's where the highest number of greetings takes place.
Exactly.
Handshake all around. Equally, inside the church, it is one of the highest overcrowding area we'll find around. So some pastors have split their masses and created so many masses per day. That's what pastors could be thinking about. Not just trying to go against ministerial order.
Yeah.
But they can split your mass. If your church is having a population of 100 people, you can make small. Why you can still stay home and still pray God is still here or still. Or you can make small masses or other prayer sessions within a week, but let them try to. They should know we are also at risk. We are also at risk. Yeah.
In Italy, it's online. There are no more services. All of that is stopped for now. It's done online. You can watch. You can follow online, just to keep people safe. I mean, I think God is happy when we are healthy, right? That makes God happy. He doesn't want us to be sick, and doesn't want us to contaminate or be contaminated by others. We're going to continue. We are now ready to take on your calls and more messages. So the gentleman whom we are unable to take, we are sorry. If you call us now, we'll be able to answer your question. While we're waiting for that call, we're going to continue talking about okay, so there's someone already online. Hello, welcome aboard the diary. Your name and your contribution. Okay, go on, sir.
Hello?
Hello, sir, you have our attention. What's your name and what's your question?
My name is Mombe Bazel. I'm calling from Douala. Hello?
Yes, we can hear you loud and clear. So what's your question?
Yes, my question is this. As the doctor just said, that the mask will soon get finished, and I got information that those masks are supposed to be used just for 3 hours. When they got finished, what are we going to do? So I want to know, because it's an effect if it gets finished, and which we have the disease real in Cameroon. How are we going to survive? Thank you.
All right, thank you, sir. Good question. Dr. Eric.
Yes, we say use mask only when necessary. Okay. Yes, you will not need to put mask every 3 hours per day. If not, you're going to weigh about 8 masks per day. So use mask only when necessary. When you have a suspected case, you have an infected case around you, that's when you use the mask. So far, I don't think there's a reason why I need to wear mask in Douala. If you respect the measures by staying in your house, there is no need for wearing a mask in the house, if you respect what the minister said. If you stay home, it is no need to wear the mask. That's why if you want to use the mask and waste it, we will soon run out. It's just like I was just talking about the chloroquine. I don't know what people are buying chloroquine to do in the house with. Because when you be sick, you will not treat yourself in the house. Chloroquine is meant for treatment. It is not for prophylaxis or prevention. Yeah. It is finished, first of all. We are talking about hydroxychloroquine even. So when you are taking a drug at home, that's you are doing auto-medication, be ready for side effect, be ready to suffer more in the house than ever. While in the hospital, we use that to treat it. It is believed in Cameroon, we have the first 2 cases being treated so far. The doctors are doing their work. Let the doctors do what they are meant for to do. And they can do it. They are the ones to use that. The hospitals certainly have them, and the treatment does not even last for long. I'm surprised we're buying large stocks. Chloroquine is finished, the mask also getting out finished. I don't know what they're doing with them in the house. So I just want to call that to the public that they should leave the work for the medics. Yeah. They have that place. Try to prevent is important. Prevention, they say, is important than cure. Don't go and start with cure and you're mixing prevention all around. The secondary effect of the drugs are sometimes very serious if we don't know what it means. So
yeah, and if you're worried that the masks are going to run out, then don't use them if you don't need to use them. Leave it to those who absolutely need it, those who are sick, those who are taking care of those who are sick, and the medical personnel, they need it. I mean, this problem is really serious. Cameroonians probably do not get it. Even in the United States and in Europe, where these masks are manufactured, they are running out. The government is funding companies to, make fresh ones. So it's going to be an issue. We do not make them here, we import. So imagine what happens when we run out, and then we cannot even import because they too are having issues. They have run out as it is. So if you do not need it, please do not wear them. I see people in their air-conditioned cars, the glasses up, and they are wearing a mask. Like, why do you need to wear a mask? Okay, we have another caller on the line. Hello, good afternoon. Welcome on board the diary. Your name and your question.
Yeah, good afternoon. I'm Afefe Johnson calling from Santa in the Northwest region. I have a question for Dr. Anita. I'd like to ask, is it that God has decided to punish the world with this coronavirus, or what does she think about it?
Okay. Thank you for your question, Dr. Anita. That's all he wants you to answer his question.
Okay. Well, personally, I have my own personal opinion, and I will not share my own personal opinion because it might not be true. Because I've not had any communication with God lately about coronavirus. He has not spoken to me to say that coronavirus is a punishment. But for now, coronavirus is a problem. Let's take it seriously. I don't know if he has a spiritual background or he has a political or he has whatever. All those aside, it will not change the fact that this is what we are facing and this is what we should address. So I think that's what I have to say.
Okay, thank you very much for answering that question. Another thing, Cameroonians say if you eat onion, you eat garlic, it's going to stop you from getting the virus. Is it true, Dr. Eric?
Yeah.
Should people be consuming garlic?
I think the minister clearly answered that question in the press that all the ginger, the honey, everything they're taking has never been tested, and it cannot be has not been proven at all against this virus. So we should not count.
We'll go back to that in a second. There's another caller online. Hello, good afternoon, welcome. What's your name and what's your question? Hello? Please, sir. Okay, before you call us, you turn down the volume of your receiver, or you go very far from your TV set, okay, before you can call us. If not, we're going to have these problems. Hello, good afternoon, sir. What's your name and what's your question? Hello? Okay, so the caller has gone. Just to make this clear, so that we do not have any issues when you call, so we can hear you properly. When you call us, turn down the volume of your TV set. You can hear us directly on the phone, or you move away from your TV set before you call us, okay? I hope that is clear. So let's go back to answering that question of whether or not garlic, onion, and all the others help us against the coronavirus.
Anyway, so far, the only thing that has been proven to be effective is only the hand sanitizer that has been proven to have an effect on the virus. Every other thing that is proven, I don't know, this is time when many of these native doctors will go around with their products. Some already singing in radios that they treat coronavirus, etc. I don't know.
That they have never tested, they've never tested, never tried.
They don't even know what they are talking. They've never seen them. They don't even know what to describe about the virus. They are talking about treatment already. So I want to tell the population that they should understand the fact that none of these products, the minister fully answered this question on the press, that there was not been any proof about the ginger or the garlic or the honey or whatever they are gathering about. No test. People should understand that what is shocking Italy today is because they neglected most of the measures taken for isolation. Isolating people, keep them back, they never believe. And this is the same thing that will happen in Cameroon. People are not believing that they could stay behind locked doors without going out in the crowd, etc. And that's where we're going to be victims. Somebody asked me a question about the mask. The mask will really be small because if you look at the number of masks produced, masks were mostly meant in the theaters.
Yeah.
That's what we use it. How many theaters do you have in Douala? How many times do you have surgeries? How was the command? So producers don't produce large quantity because they know how often we use it. You can imagine the population of Douala alone. How many masks can you wear? Can you wear a mask on every person in Douala alone? It's impossible. So the best way is to stay home, let the few cases that have been identified be treated, eradicated, and then we'll be safe now. So let us not count on the native doctors. We don't know what they have. They have nothing proven. China has studies that have been doing all this short while and they're publishing them. Articles are free online for us to read and access them. There's no article for you to pay. The articles are free to read and access. Studies carried out has been done already. You can go through them, read and understand. Preventive measures are all around. Many questions asked and many answered by WHO. So we can have many of them to clarify ourselves if we lack information. Just go online and you can type coronavirus WHO. It's simple. You get many questions and get responding. Don't listen. We look at WHO because they give us answers that have been tested and has been proven in good laboratory. They can give us a clear number of cases identified, what is active against it. Even the hand wash we use today was properly described by WHO. Each of the entities and the concentration. For example, the hand wash, the alcohol used is not any kind of alcohol. Don't go and take alcohol and put water inside and dilute it. And you take and prepare a hand wash it because that's what people are doing now faster to sell.
Yeah, unfortunately.
The glycerins are all finished in the pharmacies.
So
you will not see iron peroxide. They have bought everything. People go and stock them in the houses and are washing all the time. There is a description by WHO. For example, if your alcohol is not at least, they say at least 60%. But WHO wants you to have 90% and above, maybe 96, maybe, I don't know. If your alcohol is not at that concentration, it will have no viral effect. It will not kill the virus. So your hand sanitizer will just be for nyanga, maybe say so. It will not help you. So I think that you should look at the sanitizer you're having in your hand, look at the description, look at the content, look at the quantity of alcohol present, the percentage of alcohol used, even though I don't know. This is time for business now. I don't know if people can still write those things and frame it. I don't know.
It's so sad that the prices have gone up and people are trying to exploit it for their benefit, forgetting that we are facing a situation and that we all have a role to play. It's really heartbreaking actually to see what's happening. Something else that I wanted to ask about. They say if you drink water every 15 minutes, especially hot water, and they say if you gargle hot water and salt, it will kill the coronavirus. Is it true, Dr. Anita?
It will not kill the coronavirus.
I hope we're hearing.
Before the virus even reached Cameroon, there was a video of somebody that called himself a professor in virology, and he said something about vinegar, that if you swallow the virus when it's still in the throat and it goes into the esophagus, the hydrochloric acid of the stomach, all of that sounds very scientific, but it's not true. So one thing that I want us to know is that most of these countries, they are facing this same problem. So when they think, even when they hear of these things, they go and they think about it. They don't just discard it and no, this cannot happen. They go and they test it. Like, even like garlic. Garlic has been tested, it's like an antibiotic, but it has been shown that it doesn't have any effect on this virus. So it was tested. Even about the hot water and all those things, they have been tested and they have tried all of it. It's not as if they have not done anything, so how can they just prove that it has not happened? And I always ask myself that, you see that Italy doesn't have garlic, or China doesn't have onion, or they don't have hot water gargles. That's why they are having thousands and thousands of cases. Then we are super Cameroon, we have garlic, we have onions, so we can prevent these things. So let's just think more through and not listen to everything that we hear in the quarter.
Yeah.
But we should, as you said, we should check online and find the information, and we believe what we find there and take all the preventive measures.
That's right. Unfortunately, we have run out of time. Just very quickly, your final words. This is just the beginning. We're going to continue talking about the coronavirus until we beat it, okay? This is the first week. We'll come back again next week. But quickly, Dr. Eric, your final words before we end the show.
Yes, I just want to say that with all these kind of notions of treatments at home, with garlics, etc., sanitizers, etc., people buying chloroquines and keeping their house in stock, the effect over on the long run will be that those who will start manifesting symptoms will try to take it home first. And by the time they wrongly handle the virus, it will reach to a very complicated state where they will need to be admitted in an intensive care unit. As I already said, we don't have us a lot of intensive care in Douala or in Cameroon to keep these patients with. If Italy can tell you what they are going through, you understand what it means. So that is the effect. That is how you instead kill us faster than ever instead. So the advice to the public is to understand that the hospital is meant for that. The chief symptoms you have described, which is the temperature, the fever, the dry cough in particular, and then maybe you're having a sore throat. That is the chief symptom we can present in the beginning. And if you have a case like that around you, it's good to rush to the hospital. We'll send you directly to the center made for that suspected case. And if you are a case we identify, we'll rush back again to the area to see how we can carry isolation and keep everybody around the environment under isolation principles. If that is the case, we must respect also the measures taken by the minister equally to make sure that we isolate and avoid overcrowding. Heat has an effect because it inactivates the virus, but it will not kill him or whatever. It's just like putting something in a fridge to cool it. It gets cold, the guy is inactive, but when it gets hot by, it becomes active. So inactivation does not really kill him. Equally, people believe also in some particular conditions also which we have described, but we have said the prevention was better, which involves the hand wash with soap.
Yes.
It's
and
more
running water.
Running
water in a bucket.
Running water. I advise homes to say that go in your house, look for a bucket with a small tap, you put it on the side and you put small, even the soap inside the water.
Yeah.
I advise liquid soap to put inside the bucket of water. That's what we do in our hospital. We put a liquid soap inside water, we put on the side. We put a small, maybe a tissue beside it. So when you open the tap, you wash your hand with soap water. It is better. Each time you have gone out, each time you come back, even in front of your chair, your offices or your small work site, that is more better than the sanitizer, because the sanitizer also are already getting finished.
It's true.
It is expensive and it's difficult, but the soap is in the first place. Sanitizer are just an expensive mode of soap now. Thank you.
Okay, and you quickly, Dr. Anita.
Okay, my final words is that this virus started in some countries with the same numbers we have now, and in those countries they're having thousands and thousands of cases. So we should not think that we cannot get there. But this is not to make us panic. This is not to make the population to panic, but it's to make us to be concerned. And one thing that I want to urge Cameroonians is that you should not try to protect only yourself. You should think about the other person. Because if that other person is infected, and if that person succeeds not to infect you, he will infect your brother or your sister somewhere. So now is the time for us to work in solidarity. It's not a time for us to scale up prices for things for our own personal gain, to go and buy everything in the market and stock it in our houses. It's a time for us to work together and to listen and follow all the practices. And I also say that we should pray. We should keep trusting God, but don't forget to practice your hand hygiene. Don't forget to wash your hands, as Dr. Eric said, to practice when you're coughing. If you have the cough, don't start coughing into everywhere. Cough like you showed into
your
your
bent
shoulder,
elbow.
sneeze into your shoulder. And if we continue to do all of this, we'll be able to contain this if we work together as a common people, like as Cameroonians together now. No Anglophone, no Francophone, nothing, just Cameroonians.
Well, thank you very much, Dr. Anita. Thank you to Dr. Eric for coming. And please, I hope you take to heart what you heard today on The Diary. We'll be back again next week with the same subject. Like I said, we will hit on the coronavirus until we beat it out of Cameroon. Take care, but most importantly, be safe, okay? Bye-bye.
Yeah, the first place, right.